My name is Carrington. I'm 83 years old. I've spent my life teaching French, mainly to girls, in Blackpool. I've been a parliamentary candidate in Blackpool South, and I was a local councillor for 12 years. And since I gave that up, I've been working for the local MP, Gordon Marsden. I knew that my eyes were drying because I'd been told that, and I was told to put a lubricant in several times a day. And I woke up one morning with very, very painful eyes, really seriously hurting. So I was referred as an emergency to the eye clinic on a Friday afternoon. Got up there about 3. It was absolutely packed, but I was seen before 4 o'clock. Had a complete eye examination, and the problem was solved immediately. He soon realised, the doctor, that although I was putting the lubricant in, it wasn't enough and that I needed more. So he diagnosed it and said 2 lots of lubrication, alternate them, and every 2 hours. There was no time wasted. When I said I had this violent pain, I was there as an emergency. I was rung up in the morning and I went that afternoon. So I mean, it was just brilliant for service. I went up there and I was seen very quickly. So it was all great. But before I came out, a member of staff came in and said, "We've got 3 more emergencies just arrived." This was about 4 o'clock. "We can't see them, can we? Because we won't have time." And the doctor simply said, "They're emergencies. We will stay till we've seen them all." And I thought, this is the NHS at its very best. I was so impressed. I don't remember his name, but he was quite young. I don't remember really, because all young men look the same to me at my age. But he was very pleasant, very thorough and very reassuring. And he was absolutely confident that putting these lubricants in every 2 hours instead of 3 or 4 times a day, which I had been doing, would solve the problem, and I've had absolutely no problems since. They feel very much better. I feel very comfortable now, no pain at all, and I can see perfectly well. So no, it's solved the problem as far as I'm concerned. I would like to say that young men like him are what make our National Health Service what it is. It is wonderful, and it's because of these magnificent people who, in spite of all the problems, and I know there are many problems, funding and staffing and so on, still behave in a thoroughly professional, sympathetic and reassuring way.
Hi Pat, thank you so much for getting back in touch. I was so happy when I heard your feedback. I'm Dr. Lai, the doctor who saw you on that Friday afternoon. Same Friday afternoon again, and you know, with the increasing the amount of pressure in this current climate, but it's patients like yourself that makes us want to do that little bit extra for everyone. And thank you so much for your feedback, and I'm so happy that your eyes are actually better now.